your participant ID followed by pound. Otherwise, just press pound to continue. You are in the Zoom meeting now. There are 2 participants in the meeting. This meeting is being recorded.
Somebody else.
Words on her screen. There was a button that said mute. Yeah, right there.
Unmute them.
Can you hear us?
Hey, girls, there's
Yeah.
You hear us now? She hears
Thank
us.
you.
Good. I'll go check to see what's going on.
I was thinking this other, I don't know if you can see that, but I'm thinking that might be you too. Is this you?
Yeah, I can hear you.
I think because, let me mute that.
You can mute or unmute yourself by pressing
That's crazy. Maybe that, is that better?
Yes.
Okay. I don't know why
No.
it's going like that. Am I echoing on your side?
Not sure. That's.
There, you sound better now. Do you hear me, Becky?
always forget you don't like cold cuts. Get $49.99 to spend.
Becky, do you hear me?
Watermelon. You're welcome. Eat some watermelon. Watermelon. Second. Yes, ma'am. Please.
We're having technical.
Zoom. Enter your meeting ID followed by the pound or hash sign.
Can't hear her?
Well, now I can't. Becky, I don't think she can hear me. I think she might have muted it, her side.
Hello?
You hear me, Becky?
Yeah, I'm calling on the phone. I can't get this mute off of the computer. It's a lot of feedback.
I wonder why.
If you're ever gonna get Dale anything, he doesn't like cold cuts.
Hey.
God.
All right, I'm gonna let you over there, see if you can figure out that echo.
And there's a sign machine. All right, let's see. It's probably this. Can you hear me if when we're closer to it? Becky, can you hear me?
I don't think she can hear. I'm thinking she might have. Becky, do you hear us?
I'm going with no. Yeah, I'm going with no.
Can you hear me now?
I can hear you.
Yes.
Good. I got the computer to work.
All right, do you hear us?
Yes.
Okay, good.
Awesome.
That's why I came in early.
We wish we could invite you to have some snacks, Becky.
I could, yeah.
Do what?
I I could invite you to have some snacks.
I have some snacks, but thank you.
Would we be okay with that?
You can hear us okay?
Yes.
Okay. I'm turning up our little microphone a little bit, just in case. This one is lost.
Well,
She says, I'm looking for my key.
Is this mine?
Nope,
Or is that mine?
nope.
Mine?
Hold on.
Yeah.
Wow. It's a crowd.
So you made it through Florida, okay?
I did. We made it to the hurricane.
Yeah.
It was fairly uneventful.
Becky, we'll start in about 5 minutes.
Sounds good.
So do you need to be on the lookout for more of your people?
It's usually just me.
Maybe one more.
Okay.
Yeah.
Yeah, she
I
just
think
was
April's coming.
not sure where to look. And I said,
Manager
well,
April.
Wasn't it in the other one last time?
Yeah, it was.
Well, then.
The last time we had a big crowd with mine, today too.
Was it chilly?
Like I have heartburn already.
Oh, okay. Okay.
Thank you.
You're welcome. See you later.
She told me you were going by Starbucks.
Hey, I've been getting a drink
You have?
and I didn't know it. Double shot with vanilla?
Yeah.
Yeah. They're like, and you want milk? Oh, I don't want milk. I don't want milk.
You
They're
want
like,
Dale?
oh, so you want a Dale? And I was like, a who? A Dale. That's what we call it. You know? He's like, you work at the hospital? I was like, no, 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 no. It's not Dale. This is a double shot. This is vanilla. They were confused. I don't know.
Do you want some snacks?
Maybe.
There's some snacks next door.
I'm
really
okay.
Are you sure?
Yeah, I think
Just get
What's
some on
Starbucks?
Dale's plate,
Dale says it's
or I
spicy.
see you load it up.
They
I'm
have
a
other stuff
chicken.
over there too. You got roll-ups with, what's that?
Same cream cheese and chili. Oh, pinwheels. No, she
No.
just put in turkey.
Yeah.
Oh, look at that.
Like so.
Try it, yeah.
Anna was on top of it.
Almost. Got it. Oh, Devon, when do I have students out of town?
The 6th, 7th, and 8th.
Okay.
Friday, Saturday, Sunday.
Okay. What are we doing for lunch?
But we have food money. I think we're gonna do pizza 9. What do you want? Like, what do
Jimmy
you want?
John's.
Jimmy John's, Subway. What else do you not eat?
Speaking of which, we unfortunately approved us some flowers to make.
Remember, you have
I think it's
Becky
budget.
over there that you're talking to, Savannah. Don't forget about her.
Oh, hi Becky, sorry. It's like, but
So there we
I don't know, but we have
For limit.
$49.99 a day. So one day we're gonna get breakfast
No.
items, Maxine's gonna get breakfast items,
Just in case.
and then at Sam's
Wanted
Club,
to
and then the
come
other
share
3
your
days we'll have lunch.
So,
I don't know.
That is odd. Never thought cheese and crackers would be hot.
Is the chili too hot?
That's Becky, and she's from Alamogordo. We'll go around.
Are you from New Mexico?
Me? Sorry?
Dale.
He's been here
Everybody
long
was
enough.
thinking that. You didn't need to say it out loud. You were so honored. Someone see it. I'm joking about
I
it.
didn't want anything, and then I got a full plate of stuff. So
I didn't put your name on nothing, just so you know, Cassidy.
It's about time.
Put your name on nothing.
She didn't put it on there because she's afraid.
Could have
What
put
if I spell it wrong?
She knows. How many years has this been?
Been almost 3.
Well, then.
You just go to drive through Starbucks and just ask for a Dale.
I'm not doing it. I'm not gonna
You have
ask
to
for a
try it at
Dale.
least once.
or quit going to Starbucks.
Just way out of the way for you.
Or quit going to Starbucks.
He has a coffee shop.
I was gonna
Oh.
say, what?
Sweet.
Cody's husband runs a coffee shop, like a mobile one.
Which one? The one over here?
On Butler, Fox Hill.
Oh,
really?
I've seen that one. I've never stopped. Can he pull up right here now?
Be here in the morning.
Right here in the morning.
Let me
I'd
go
be all
make
over
sure
right
I'm
there.
just wandering
They're,
around and then
Okay.
I'll go.
Are they?
Becky,
No,
I
I'm
did
gonna change
email
it.
you the
Change it to
agenda.
cats.
Yeah, I just got it on my
Okay.
phone.
I'm gonna
Thank you.
Mhm.
order this, the cat.
Can't do it.
Yes, I am.
Did everybody
When that
sign
group
in?
wasn't on the menu, they were calling them, yeah.
Not introduced Starbucks. They don't know yet. They don't know any better yet.
You know it.
Did you? Did you sign it?
Go from plenty of room to be, you can sit next to Kathy if you want. And you can grab
I don't buy it hard.
And if she bites, she knows some people who can fix. Some, yeah, there's some snacks in there. We'll get Barbara on a minute.
Yes, right.
Gabbana.
Okay, I need the recipe for that.
It's really good. She says, go to Sam's Club.
Go to Sam's Club.
Is that what it is? Is it in the
It's
tub?
like a cream cheese with green chili is what it said.
So it's like a tub O spread. You can buy at Sam's.
What are you having, Becky? What kind of snacks are you having over there, Becky?
Just some Funyuns. Nothing fancy.
Are you planning on coming with the students here in 2 weeks?
When are they coming?
The October 6th.
Hmm.
Certainly cover travel and lodging.
I'll have to look at my calendar.
Okay. Virgil says we can put you up and we can have a girls' night out.
There you go.
Oh,
Might turn into a few nights.
That Best Western down here is a pretty nice taste. And you get a real good deal there for that.
When I get back in,
You don't have to go to that place. You stay down water.
Well,
Yes, please.
I would put it 3 people.
Watermelon.
Just watermelon?
Very good door at night. I know you're on the nightstand. It just
I forgot her name.
was awful.
What's her name?
Kristen.
Oh, yeah. I think it's where he
Where I
stayed.
Oh, it was travel. I think it was called the Travel Lodge.
Like right there near.
What happened to my princess? I don't want you working at Sound Regional anymore.
I'm not there.
Students.
You're gonna
There were
visit
a
me
lot
more
of-
though.
There were a lot of
Right?
sad people.
For sure, for sure.
Yeah.
They're supposed to sign up for my privileges over there, so.
What?
So we can look at it, I'll come over there. Do whatever.
That sign-in sheet.
Hopefully, a lot sooner than the day before.
I mean,
I like your hair, Becky. It looks nice.
Okay.
Thank you.
every time we do a thyroid.
Yeah.
I really wish Dad could be there. Man, he closes them so good. Just like, looks like I did it. I mean, obviously, yeah, he's a little slow, but I can tell the difference afterwards. I said, hey, takes time to work.
You want to grab you
I got your back, sure. Do it.
Sure.
Yeah.
Good wait. All right. Well, we'll get started. Becky, you can hear us okay, right?
Yes.
Okay. Well, Becky, we're going to start with you and let you introduce yourself to all of the group here, and then we'll go through.
Okay, I'm Becky Ross. I'm the Director of Allied Health at New Mexico State University, Alamogordo. I've been in this position going on 4 years now. I try to recruit as many as I can from our campus to help Maxine up there, and in turn it helps us get our acute care facilities the staff that they need. You want me to add more, or?
You've been a nurse how long?
I've been a nurse for, since I'm only 25, a few years, but I've been a nurse for quite some time. I have my master's degree in nursing. I have been a med-surg nurse, ER nurse, director and assistant director of med-surg, and did home health, and I work with EMS as well.
Yeah, she does a lot over there on campus.
Wow.
Yeah,
Wow.
she does. So, and she's the one who really got this program going, the online Surge Tech program going. She came to visit me and she said, let's do this.
Cool.
So,
Awesome.
Nice to meet all of you.
Hi.
all right, we'll start down there with April.
So I'm April Stovall. I'm the OR manager for San Juan Regional.
I'm Cody Sewell. I'm the clinical educator for the operating room at San Juan Regional.
Dale Powell, adjunct instructor, San Juan College, and also practicing ST CSFA.
I'm Kristen Moss, and I'm just a surgical tech student for now.
Right. I'm Michaela Skeet, and I'm also a Surge Tech student.
Hey.
Right? I'm
Yeah.
excited about it.
Yeah, and then you know me, Becky, and everybody in here. I'm Maxine Chapman, the director of the Surgical Technology Program here at San Juan College.
And I'm Virgil Caldwell. I'm the dean for the School of Health Sciences.
I'm Cassidy. I'm a surgical tech at the surgery center up here.
Barbara Whitmore, just from the public, attending the meeting.
My name is Jeannie Winchell. I'm with the Department of Workforce Solutions, Department of Labor, and I'm here at Health Science on a SunPath grant to help health science with career readiness and funding for school and employment.
My name is Dilana Coolidge, and I'm the admin for the program.
All right. So first, I don't know if everybody got this agenda. We're going to talk about the last class that just graduated at the end of July. It was our first online class, and then of course the on-campus class. So we had 15 students, right, Devonna?
Yes.
And we had a 53% pass rate, which is not good. I'm pretty unhappy about that. The online students, we had 0 pass with those online students. So I'm really working to try to figure out how to prepare them better for the exam. To date, we have, of those 15, we have 9 of them are employed, and then we have several that are still looking for jobs. And I know Mercy has an opening in Durango. A few students actually drove to Pueblo because they reached out and they need 10 surgical techs in Pueblo. So people are reaching out to us, and as long as people are willing to move, there's jobs. And then we admitted 16 students for this cohort. 4 of them are online and 12 are here on campus. We've got 2 here with us. And we started August 21st. Does anybody have any questions about any of that information?
Maxine, you said you had 50% pass rate. And what did you say about the online students?
We had 53% total pass rate. Of the 4 online students in Alamogordo, none of them passed the exam. I know several of them are planning to retake the exam. I'm just going to work harder to try to help this new group. And, you know, I've told them that I told them about the pass rate, and I told them, you know, they really have to apply themselves. And, you know, it takes just really going home and studying all the time to pass it.
What about if we were to take a look if we could find you some resources for something like not a formal model, but something like the IBEST model that they do in some of the other programs? Or you could get somebody, they don't have to be a content expert, but they could be a coach and a mentor to help with the instruction and the oversight.
They may have those in Alamogordo through Sunpath.
That's true.
Do you want me to look at that?
Could you? Could you?
Now, did you have the Zoom videos available for them as well last semester, or?
We did, and we just started Zoom with that class. And so every class time I wasn't recording every single time, but now every time it's class, I'm recording. So they have the opportunity to look at everything that we've covered in class. And I've noticed these ones aren't doing it. They're not participating and they're not doing it. And so now I'm making it more mandatory for them to check in. Because I think they kind of get the feeling like they're just taking just another class. And it's not a program, not their career. So I told them, you have to be, you got to be part of this program. You really have to be involved. To be an online student, you have to. And so I'm working at it. They're going to be coming here. The Alamogordo students will be coming here in 2 weeks. Hopefully Becky will be able to come with them. And I'm going to have them coming here so that way they feel more a part of us. Before it was an instructor that was there, and so I think they just felt separated.
Put me on deck for just 10 or 15 minutes.
Okay.
With you for the whole group.
I will.
How many in class guys?
How many what?
In class
class.
it was 8, right?
We had 8.
8 that
out of
passed.
11.
So 4 didn't.
8 out of 11.
Oh, okay, yeah.
Yeah.
Yeah, and I mean, that last class was, they did have some special circumstances. I was telling these new students, we had an overflow of pregnant students. Yeah, so we had for them, that were having to start clinical early. Just a lot of different things. And then of course they had new babies when it was time to take the exam. So they had a lot going on. So I try to think of maybe that was part of it. Maybe.
Well, I noticed like with the class, like before you come in, there's a lot of us that are early. And if we have questions, we ask each other. And so maybe that makes it harder since they're so isolated.
Yeah, and I'm trying to get them.
Getting a discussion like, hey, maybe that we'll have an online like discussion. If you have questions about it, ask a question, and that way we'll have another student answer it or something.
Yeah,
Like a group for the students.
and I did do that with the last group. I did like an ongoing discussion that was always open, that anybody had a question, you could post it there and anybody could answer it. And they didn't really use it. But with this group, I told them they have to get together as a group once a week and meet and talk about the chapter, just something to help each other out.
I think that helps.
I think it will help. So. All right, then the next item is right now, Biology 121, which is Introduction to Biology, is a prerequisite for the program. And so what I'm running into is that the students that come in for online, they don't have to take an intro biology to take any of the higher biology courses. The ones that know about it are taking intro because they have to. But what I'm trying to do is, because I'm having to sign a lot of waivers, is I'm trying to just put that as an or class. So they can take that or microbiology, and that'll work for that class. That's how nursing takes care of it. So right now I'm just working with the curriculum committee to see if we can get that changed.
Your sense of everything cool with Michael? As far as Michael Ottinger?
I think it's fine
It should
with him, but I keep running into walls with the curriculum committee. So, yeah, I'll have to keep working at it. Becky, do you have any questions about that biology?
No.
Okay. So, this is crazy, but, you know, I had to go through accreditation to get the online program started. and after working on that for months and getting it approved, finally, we started our first online class once we received approval. Well, when we went to do our annual report, we got something back that said, you went over on the amount of students. And I said, well, yes, according to the old numbers, we did go over, but we started an online program, so now we have more students. And they said, oh, well, you didn't ask for approval to have students. So now, yeah, so now I have to go back to accreditation, and Devonna's working on that right now. We have to request approval to have students for our online program. So that's what we're working on right now. So right now our online students are illegal, but it's okay. Yeah. So that's what that was about. So we're going to increase the capacity from 12 students to 22 students, 10 of those being online. And then some program goals. Alamogordo students will be coming to campus for labs. And I hope and I think that we will see an improvement with those students because they'll be more involved. They'll be here on campus. Dale's going to be taking care of those labs. And I know with this last group, I had a lot of compliments about the students that were coming out of the program with his help. So I know that it's made a difference. And Zoom meetings is something we started with the last class, and that's what we're doing right now with Becky. This is a Zoom meeting. And so at the end of a meeting, if somebody wasn't here and wanted to watch it, I always post it and they can watch it. Mix is something we use for PowerPoint presentations. And it works really well, but just figuring out all the little quirks of it has been challenging. But the students are working on it and they're getting it. You can record videos on there, or you can record yourself. It's really nice. It's very helpful.
Maxine, I just wanted to add that for Zoom, those videos are available on YouTube because we have to convert them. They go through YouTube before we can put them in Canvas. So if you go to YouTube, you can find all the videos. It's SJC Search Tech?
I think so.
Surgical Tech, somewhere along that line. SJC's first, though.
Yeah, what I'll do is, if anybody wants a Zoom video, like for any of the stuff that we record, let me know because I can just send you that link. That might be the easiest way. So some program outcomes. We had 100% graduate from the program. And I was kind of thinking about this after this was already printed. We did have one student who dropped out of the program. She was one of the ones that had a baby. And she went for the fall semester and then spring. And her baby had some problems and had to be sent to Albuquerque. And he needed a lot of care, so she just felt like she couldn't handle taking care of a baby that was premature and just already had health problems. So she might possibly come back in the spring to finish. And then we talked about the pass rate. We're continuing to work on hiring a full-time instructor, and hopefully someday very soon Virgil's going to come to me and say, tell Del he can come on full-time.
That will be a good day.
It'll be a very good day. Yeah, I know that the program will benefit by having a full-time instructor because then, of course, Del would be able to have a lot more time to focus on just the program. Because as it is, he's working full-time at the hospital, and then in any spare time he has as a full-time father and husband, I don't know how he has any time at all. He is, doing his best with students in lab. Surveys have always been a requirement for accreditation purposes for graduates, and then also employers. We send out surveys to employers. It used to be that we had to wait 6 or 9 months.
6 months and 9 months for employee.
Yeah, so 9 months for employers, but now accreditation changed, and they said we can send out surveys anytime we want, as soon as we want. So, but I still feel like we need to give time, because, you know, if somebody's only worked for you for a couple weeks, you're not going to know what kind of, what they know, because anytime you start a new job, regardless, you're not going to be great. It's going to take a little while. But so it takes some time to actually know how well they're doing, and if they were properly trained to be good entry-level surgical techs. So far, graduate surveys we've got a 66% return rate on those, and then we're working to get more. We try to get 100% if possible, because we want to know what the graduates felt like maybe they didn't get from the program, anything. And then we offer those surveys online. They can fill them out online. We'll send them a survey. We'll put one in their hand. So we try really hard to get those filled out. The employers are usually really good about returning those to us.
With that pass rate, where it's at, will we have any exceptions to answer for from the accrediting agencies, or?
At some point, if things like that happen, if we don't have enough people being employed, if we have a poor pass rate, if we had bad graduation rates, then accreditation will start looking at our program and asking what's going on. What are you not doing to prepare these students? You know, so they will come and they'll do a site visit. We had a site visit a couple of years ago because of pass rates and things like that. So that will happen if we don't make improvements. So I'm working on it, because I don't want that to happen. It's a lot of work when they do come. So we want to do our best to avoid that if at all possible. This year we decided, and the reason that I decided to start having the students fill out a survey of the facilities that they were going to was because San Juan Regional had requested information feedback from student surveys of the facility. So I thought, well, I haven't done that in the past, and I felt like it's a good opportunity. The preceptors always give us basically feedback on how the students are doing. So I felt like, okay, well, how about let's have the students give us some feedback on how preceptors are doing for them. And so far I've only sent back the results to ASH and to San Juan Regional, and I'm going to continue to have those surveys filled out. I feel like it's a good thing. It's the students' way of giving us both positive and negative feedback. And then if things need to be changed, then let's do what we need to change them. If we need to do things with our students, and I really, really want to work on things with students. I know the last group of students that we had several that were really quiet, and so I think they came across as not being interested, and that's just the way they are, and that's something that's almost impossible to change. When people are shy and they hold back, and then they go to clinical and they still are like that, it's really hard, because I know that their preceptors look at them and think, you're not asking any questions, you're not talking, you must not be interested. So I know we're really trying to bring out anybody who's kind of hold back during class. We're really going to try to work on them and try to teach them, you have to talk. It's so important for a surgical technologist to speak up when things are going on in the operating room, and then to show interest to a student.
I think the mixed presentations will help with that because you got to go up in group and you talk, and at least they're going to be comfortable because of classmates.
Yeah.
So that helps.
Yeah.
Being in an operating room, you get a little intimidated because you have a technician looking over your shoulder, and you have a scintillating nurse that's standing over there staring at you, and you have the surgeon that's you want to watch every move that you make to make sure you don't contaminate.
And then you gotta go.
Oh, I've worked in jobs before that are they micromanaging. Like I know my job, but they're like, just gonna watch. I'm like, that's fine. You can learn too.
Well, one thing about surgical techs is that we have to prove ourselves to. We have to go in as a student and prove ourselves to everybody in that room. If you make a mistake, the first thing you do, you go and you contaminate your gown and your gloves. Right away, they're like, you don't know what you're doing. You need to get out of my room. You know, so first impressions, it's huge. And I've told these students, it's big. If you go in and you don't seem like you're interested, or you don't know what, or they think you don't know what you're doing right there, you know, it's like,
Or you walk in not wearing a mask.
Right.
Could you utilize the sim as part of that? Maybe inviting some of the employers to come in, doctors or whatever, to be in a setting where they have them already there, knowing A, they're from an operating room, and B, that they're employers. Is that something we could utilize?
We have had a surgeon that worked with us in the program before. I felt like the only problem with him, and he's a great person, is that he was, quite honestly, he was just too nice.
That's what I'm thinking. If you have like bad sims and good sims, you know, you have the bad doctor, good nurse,
Yeah.
bad nurse, good doctor, you know, try and provide that. Because when I met with the nursing advisory board, one of the questions that they all brought up was the nurses have a hard time with being talked down to or how to deal with that conflict when you have a crunchy situation, you know, and they don't know how to separate themselves from that. Is that something maybe
I think so.
I could help you with from the
that would be
workforce?
great.
And use the Sims?
You know, to kind of try something similar to that with the last class, because each one of them, I have them, you know, okay, I'm going to play the surgeon, you're going to be the tech, someone's going to be the assistant, and Derek, for example, he was sweating bullets by the time we were done.
Well, Derek was like that though. But what if you brought somebody in that they didn't know? It could be Virgil.
Yeah.
He could come in and be the doctor. They wouldn't know he's not. Well, you are a doctor, but when, he's not a surgeon. You know what I mean? And he could play the hateful surgeon, and April could come in and play the good nurse. All those things. He's the good nurse. Always the good nurse. That's why I said that. But I'm just thinking, those scenarios, those hands-on feedback are just really, especially with people they don't know. If you didn't know when Virgil showed up and was hateful in your sim, you wouldn't know that he wasn't a surgeon. You'd probably spit on him in Walmart when you saw him.
No, I worked there, so I wouldn't be able to do that. I'd be like, how can I help you out today?
Do you know what I mean? So it's just a thought. Start using it.
Yeah, and I've always felt like going for observation helps to kind of ease that stress a little bit. I think it does help some, but I don't think there's really anything compared to actually scrubbing in and being in there and feeling like, oh boy,
here we go.
I'm being watched. Here it is. Here it is.
Since you brought up observation, I know that they're not supposed to scrub in, but I almost wonder if they did scrub in, not past instruments, but scrub in and we're at the field, if that wouldn't help them be a little less timid or less intimidated, because they could, hear those conversations. Because if you're standing back as a circulator, you can't always hear the conversations that the surgeon and the surgical tech or the surgeon and the first assist are having. And you don't necessarily get to see the passing of instruments depending on how many people are scrubbed in. And so if they could maybe scrub in, stand on the other side of the Mayo stand or something like that, and just be more engaged at the field, that might help some of that.
maybe.
Standoffishness. And they'll get to know the surgeons a little bit more because they come in for observations and they're so timid that it's even hard to get them away from the wall. You're like,
Oh my
scoot up, just move up
Oh, yeah.
and get closer. So
The only issue, I guess, I tried that not last year, but the year before, and a lot of the preceptors were asking them to do things like you need to do, and I don't know if that was your
It was my
class.
class. It was the class before mine.
Okay, yeah, they were asking, they were, I think they were confused.
Mhm.
They felt like they were supposed to be in there doing things.
Right.
And I was like, no, they're not supposed to. They're really just,
We're just kidding.
because Dr. Yates was actually the one who made that recommendation that we do that. She said, they're here, get them scrubbed in. I feel like they're going to learn a lot more if they're able to be right here. And I agree with that. And if you feel like that, it'll make an improvement. And as long as the preceptors that they're with know that they don't really know what they're doing.
right, well, that would land
They're
on
not
us.
supposed to be.
So we would have to understand that what stage they were in and then convey that to our staff and be very clear about it. They are strictly here for observation. And I think over the last year in our facility, we've had so many students that are there for observation that I think it would be more of an accepted thing than maybe in the past because we didn't have as many students just there for observation. And that's not just techs, that's just, students in general.
Yeah.
So I think that that would be more
That would be good
understandable for our staff.
to do in waves too. So you've been here 8 weeks, you're going to do your first observation. This is what it's like. And then you've been here, this is your second semester. Some of you just like throw them out there, not to do anything, but in that observation is really good because now you know. This is what it's really like. Is this where you want to be? We don't want you to come in and be here for a year and then drop out because you just all of a sudden realize, holy smokes, this is what I've got to do. And you're going to yell at me, you know? That would be awesome. That's awesome.
Well, and then I don't know how we can convey this to students or just new staff in general. Is the surgeons yell, but that's not necessarily yelling at you. You know, it's more of the situation. But I get it when you're new, you kind of take that and you own it, and really you shouldn't. You know, it's more of a situational anger or intensity than it is just, you know, you're doing a bad job. If you're doing a bad job, you're going to be asked to leave. Yeah, but if they're not kicking you out of the room, you're not doing a bad job. But I don't know how to make new people or students understand
Well,
that.
this is a good way to start because we've got these two, and so when we're in class on Wednesday, they'll go back and they'll tell them about this meeting and, okay, when we go for observations and a surgeon starts getting upset, we need to remember it's not us. Thankfully, it's not us. Yeah, to me, it's like when you're a student, you get to actually relax because when you start working, that's when the pressure starts coming on.
Yeah, it's all situation based too. Like you just have to recognize the situation pretty much. Like if you're not paying attention, all of a sudden he's mad, you're probably gonna think it's you because you're not focused, like you're not paying attention to your build. But if you see like his insensibility and he cannot tie the suture and everything's going wrong and no one's holding the camera right and like it's annoying. And you're like, dang, just I can't see. Or it's them. Usually they're mad at themselves most of the time. And then they get over it and they're like, oh, so how's your weekend? Like, holy it's not you.
Bite your head off.
Just be quiet. Just wait till he's done.
It's like being married.
Yeah, and you do have to, and that's something the students will learn, you have to realize that the situation, and it's not you, and that things are going to change from 1 minute to the next. I mean, I know I would do cases with the surgeon. He was completely happy and everything was great, and then he'd walk out and come back in for the next case, and he was mad, and I thought, wow, what happened? So I don't know what happened. He probably went and visited a patient and they didn't write the orders or something happened that really upset him, but he wasn't upset at me. And it is hard at times not to take that personal, but you have to learn not to.
There's some information I have on classes and scenarios you can do just in 15, 20-minute increments, teaching you how to remove your emotion from the situation. And that might be a good one too. I can see.
Yeah.
Because you want to think with a clear head, because you got someone's loved one on the table.
Right.
So you got to be thinking about that more than my feelings.
Right. It's not about
the
you.
patient's care.
Right.
Let him yell at you. As long as the patient's taken care of, you can deal with that outside the room. Inside the room is a whole different story. I used to work in dispatch, and you take a 911 call, someone's going to scream at you. Nobody ever calls and says, "Hey, how are you? Just want to call and say hi." They're screaming, they're yelling. Somebody's been killed, somebody's hurt, and you have to know that you're taking that call and you're their only help. Same thing with surgery and OR. Just have to remember to leave that at the door and remove that. So I'll see if I can find those. There's a couple of TED Talks and some others that we use.
Great. Yep, something that I'm hoping that when we get to hire a full-time instructor, one of the things that Ash had talked to me about was it would be very helpful if me or the lab instructor could actually be there for the students more especially when they first start clinical. So that way it's our responsibility, and it is our responsibility to see that they know how to put on a gown and gloves. They know how to scrub their hands. That way it takes that pressure off the preceptor, and the preceptor doesn't feel like I gotta watch everything they're doing, because they know that you're there and that you're paying attention to what they're doing. Even though me and Dale, I mean, we're just two people. We can't be everywhere. I think as long as we're there for their first weeks, first couple weeks, showing that, hey, here's a problem. Let's go back. We're going to get you out of this room for right now, and we're going to go work on this. You're really struggling with draping, or you're really struggling with putting your gown and gloves on. Let's just go back. Come on. Whatever the situation is, if you're nervous or whatever's going on, we're going to help you out.
The advantage of that too is that as a person in an authority figure role, that your known variables, or when they go out to put the student in those clinics, that's really an unknown variable. I mean, it could be a really crazy person. Not in the sense of crazy, but just really wild and contraindicative to your own personality fit. Whereas these guys would be safe because you know them.
Mm-hmm. Yeah.
And that would make your first learning contact far more receptive.
Yeah, and plus if the surgeon's yelling and all that, we can look like, oh, they're not stressed out. We're good.
Yeah. I think it's good and it's bad, because I know that a lot of times when I've gone to check on students in clinical, when I show up, they're like, oh my God, Maxine's here. Because what is she?
Am I in trouble?
They're like, crap. What am I doing? She's already taught me that I'm not doing. So I was like,
yeah. Yeah. So, anybody have anything that they want to share about anything that we went over, or just anything in general?
So from the hospital standpoint, just a couple of things that I just want to clarify before we get going. Number one, I want to really look at how long our rotations are going to be. This last year, we had students, not just scrub tech students, but we had students in our rooms from February all the way through August. It's a lot. And by the time you get to the end of that, our surgeons, they probably are upset at you at that point, another student coming in the room, and that's where we don't want them to be. So we've really got to look at that length of time that we have students in there. Unfortunately, we might have a couple of cases too where we have a couple of surgeons who are no longer allowing students in their room. So that's gonna put us in a little bit of a pinch. So just knowing that ahead of time, and unfortunately, usually when you guys come to us, that is for general cases. So we're gonna have to really kind of monitor that a little bit. The other two things, just to make techs aware of, or the students aware of coming in, they've got to be on time. They've got to be early.
Oh, yeah.
Scrubs. Okay. So we've got an issue with being able to come in and find the right size scrubs. One size fits none. So, but we are now losing not only our extra scrubs, we are losing our scrubs are not coming back from the laundry now either for whatever reason. So they're just going to have to know that ahead of time, get there a little bit earlier. That first time when they come in, if they see a couple pairs that might fit them, they might put that in that scrub tech student locker. Just saying. To have that there. And then I am considering, just because we saw a couple of the evals that came back, and I was a little bit concerned about some things that were happening that I didn't know earlier, that may have been happening with the preceptors. So I would like to, on my end, if you guys are okay with it, what I may do at the end of their couple of weeks when they're with us, I may have them evaluate their preceptor at that time, and then I can share that information with you guys as well when we do that kind of on their experience. Just because I think some of the things on the survey we probably should have caught a little bit sooner from my side, so that I could have jumped on it a little bit sooner to help them out have a better experience. Just to help their whole.
That's a good idea.
I mean, if they're coming over there and we're supporting them, they need to have a good experience in what they're doing.
So the clinicals have always lasted 14 weeks.
Okay.
And that's really what it takes for them to get their cases. I don't think, if anything, we would need it to be longer, but I don't know if it would help you if we started sooner and maybe just had breaks in between. I don't know. That's something I wanted to talk to you about.
So 14 weeks would put us starting the middle of April. We go through July. So this year we started the beginning of March. And that extra, the pregnant girl, that extra 6 weeks, because we're so general heavy, especially at the beginning of their clinicals. You know, it's all general. This is the only place they're going to get general. So towards the end, they were mixing them up a little bit more because people are coming in with more general cases. But this year, we lost a general surgeon or 2 general surgeons, and so we were left with just 4. And the 4 were getting killed, you know, with students, because it's not just the tech students that are coming in. You know, general cases are the better cases for the RN students to see. The x-ray students that are coming in are anesthesia students that are there. And we can't put more than 1 student in each room. Plus, we tend to put our scrub techs in, like, the general service. If we have general service scrub techs, those scrub techs are the ones that are scrubbing those cases. And so those are the ones that tend to get students over and over again. And we're just burning them out. And I don't know what else to do, because the students are coming in telling me that they need general cases, so that's where I'm putting them. But our best general techs, which are the ones that they need to be with, they're like, I don't want a student today. They're asking me, can I just not have a student today?
Oh yeah, I've been on that side, and I remember it's so much easier to do a case without having a student in the room. It's, you know, you just do it, and you don't have to think about, I gotta explain why I'm doing this and why I'm doing that. You just go in there and do it, and it's different when you're teaching. It really is.
And I don't know, I'm assuming that most of the general cases are done at San Juan Regional, but if there was another facility that could help us with general cases, it would be really beneficial. And then now 2 of our general surgeons are absolutely refusing to have any type of student in the room. So that takes us down to 3 general surgeons that are willing to work with students, and that's a lot.
It is. It is a lot.
Who's the other one that left?
The Dunworth and Robinson.
Oh. Yeah.
And so they just, you know, even with their call and everything, they were burnt out on life, not just students, but, and then we add the students to them. And
so the 14 weeks, I mean, it might work having a little bit of a break between them. You're still going to try to send 2 at a time?
Yeah.
Are those okay?
Yeah, and something else I'm trying to encourage the students to, if they know a place that they're even considering moving to, if they want to go there, I'll find a facility that will take them so they can at least do, you know, one of their rotations there to try to ease things up around here. Because Shiprock does general, Cortez does a handful, Mercy does general. Mercy's always been, I mean, they'll take like 1 student, and I've tried to tell them, you guys, you know, you're one of the second biggest hospital in the area. So it's been tough, and I'm hoping that I can get through to Mercy, and we need to have at least 2 spots there too, just to ease things off of over here.
Okay.
Yeah, because Mercy hired 2 students that just graduated, and they need another one. So I mean, they need people.
And there's no chance for us to use Albuquerque?
Albuquerque's tough because they have CNM, and so CNM basically has all those facilities. I did reach out to one that I was looking at, and they said no, they will not take any, because not only does CNM, have their program, but now they're taking 2 cohorts, so they always have students in clinical.
What
Always.
about Fort Defiance or Gallup? Gallup Indian Hospital.
Yeah, we did send a student to Gallup, and it's hard when they've never had students before, because it's almost like they don't know how to have a student. They don't know how to treat them. They don't know what they can do, and so sometimes it's overkill.
What about the folks over in Tuba that we met with?
Tuba would probably, if we can get any of the students that are interested. And of course, like with Tuba, they want their own people that are there, because they think about, well, we're training these people and they're not even going to work here, so why are we wasting our time?
That's true.
But if they had a program like Cortez, I know that Megan mentioned that Cortez has a $60,000 forgiveness for schooling. Maybe if Tuba did something like that, if you sign on a contract, maybe we would get some things. I think that was a big no, Dale. So that's something we can, because I talked to UNM Housing today. I think I haven't sent that email out yet, but we're trying to set up a deal with UNMH for OT, PTAP, respiratory, and surge tech to see if we can do housing and clinicals at the same time.
Yeah, it would be great if UNM would let surge tech students go there, because they have, 20-some ORs.
Right.
They could say, okay, well, we're going to just give a couple spots for farming.
Well, we're working on it.
Well, I feel like, if we were getting CNM students, it would kind of be like competition, like, hey, what do we need to do to improve? Because these CNM students are showing us up. So I feel like that, they should open the door and say, yeah, let's try that and see who's doing a better job. Or maybe we're both doing just fine.
But bringing in somebody from the outside with attention.
I think
Well,
because you tend to get too comfortable when you just know that, hey, we got all these facilities and we're going to send you anything and you're going to take them.
The director of education and the director or clinical rotation education and the director of housing is supposed to call me back on Wednesday, so we can work out a deal. That'd be sweet.
Yeah,
because they have a bus that goes back and forth. It's free to the students, and there's 6-bedroom apartments.
And then I know one of the online students her husband is being transferred to Flagstaff. And so she wants to do clinicals there, and I'm thinking that would be great. That'd be really, Yeah, but just like with this last class, there was an opening in Pagosa and there was an opening in Moab. And I was telling them, if I could move to Moab, I would go to Moab in a heartbeat. And I got one person that was interested that said, I'll move. And she did. She has a job over there now. And I'm thinking, should be running to get his first job. Go move someplace. It's not going to kill you to move away from Farmington for a year or so and get some experience. But
Moab has a lot of activities.
Oh yeah. Yeah. Oh, there's Virgil's timer. He says we're out of time.
It might be helpful just to tell them too. Quite honestly, we're surge tech heavy right now, and I have no foreseeable openings.
Yep.
Unfortunately.
Yeah, and I tell the students that, the chance of them getting a job around here, there might be a handful, and they're going to pick the best. Because you've got this selection of all
Free
these
market.
students. Yeah. It's like, all right, whoever is the best.
We tell them when they're coming into us, this is your interview while you're here with us.
I tell them
It
that
is.
all the time.
It's your interview. So.
Some of them understand, some of them don't.
Yeah. Well, and that's another thing too, is that if they are planning on leaving afterwards, I think some of them might give off the impression that, I'm not gonna work here, so, you know, I don't really care what kind of impression I make here, but they don't realize it. And
They may need to
they
sometime.
will not only that, but they also might need a reference from
Yeah.
somebody at the hospital that worked with them.
Well, and it could be detrimental to their learning experience as well. Because like you said, there were some people that are timid, and I think that we recognize that. But there's also people that come in and think that they already know more than they do. And so it makes it difficult to teach those people.
You don't want to.
Well, and if they're already acting like they know, then we're gonna skip that part. We're not gonna teach you. But then
Then it
if you're not
shows up
willing,
later.
right? And so I think one of the comments on our survey, one of them that we got back was that our preceptors are asking the students to set up the way the preceptor wants for each case and not the way the student wants. Well, I'm sorry, you're a student and you're coming to our facility, and we know our surgeons better than you do, so we're going to set up, and we're going to ask you to set up in the way that we want you to, but then take that as a learning experience. We try to set our students with the best surgical techs that we have, so then they have a good experience, but that doesn't always mean that they're perfect either. So those students are able, they have an advantage over maybe our new hire at our facility, because they're able to see different surgeons and different surgical techs and the way they set up, and utilize that as a student. Set up the way that your preceptor wants you to set up, and then pick and choose the things that you want to keep in your own practice. But don't fight with the preceptor, because right there's
Oh, yeah.
That's
you know,
just dumb.
right.
It's your table, but it's not really your table.
Yeah, well,
It's
it's, you know,
my
it's
table,
my
but you borrowed
table.
something
Yeah,
else.
like,
It's my table
I
and
didn't
you're
know where
borrowing.
it was.
So-
I don't want you.
I'm not sure where that comment came from. Obviously, it happened, and that must have been a point of frustration for that student. But yeah, you're there to learn.
even if
You're a
it is
student.
frustrating, not the place anyways.
Right. Well, and
I
it's
was
hard to teach
frustrated,
somebody
but
that
whatever.
doesn't want to learn something new. And I think that that was sort of a comment that I heard from some of our surgical techs, is that some of the students that were coming in weren't asking questions, or because they felt like they already knew it.
Entitlement.
And I don't know, as a student, even if I knew something, I was still sucking in all the information I could. And I don't know where that came from, because I don't remember that from previous years, or even with some of the other students, nursing students.
It's like a cultural shift I was seeing as the old guy in the school that gets the end of the complaint line. And it's been evolving over the last few years. I've only been here a year, but it's the same all of it. Is that when the students have a propensity, not all, but the ones that have it, it's really magnified now. The answer is no, and they won't accept it.
Right.
Or if you didn't make the cut on this one, it will not be accepted. And then you go through what we go through. It's an interesting cultural shift. It's like your students schooling you. And it's comical to a point, but
It's frustrating though too. You know,
Well, it
we're
is.
working
It is.
at
It's
with
like-
a timeline. Like I don't have time to argue with you.
Yeah.
So, and then with assignments this year too, I've never had anybody argue with me about an assignment. I
It's
put
pretty easy.
I put you where I think is best for you, for your clinical experience. I also put you with people that are going to help you grow. And I also put you in a situation that I'm not overwhelming my staff as well. And I had one surgical tech student in particular, I think we've had a conversation about it, that just head to head multiple times throughout her clinical experience. And it's like, stop, just stop. I'm putting you where you need to be. Please stop arguing with me. And this year it was a little different because our caseload was down from previous years. And so we didn't have the variety of cases or the amount of cases that we had in the past to be able to, keep these students going for their full 8-9 hours that they're there with us. So there were some times where in the afternoons we didn't have anything for them to do. And some of them wouldn't accept that. I'm like, well, I can't just throw a case. Like,
you go cut somebody.
You're welcome to find a quiet place and work on work on something, and if something comes up, then we'll put you in those cases, but I can't.
We have a sign up sheet going. If you still have your appendix, if you still have your
Right.
gallbladder, if you still have your tonsils,
Both your kidneys.
ovaries, whatever.
So I'm hoping that our caseload picks up and that's not an issue for this next class, but
Right now.
sometimes we just can't get you everything that you need. We're gonna do our best, and I don't ever want to send anybody home early if I can afford to not to, but
Did you ever, when I used to send the students out to clinicals for several of our different programs, it's usually best if it's done at the host site. But I would make the students give me a definition in writing of what a guest is. You know, what do you understand? Do you understand that you're going to be a guest? And it's through the kindness of these professionals that they're willing to pass on their knowledge. Anyway,
Just matter.
Oh, yeah.
because sometimes I just think there's such an entitlement that they don't get that you're being kind.
well, and it's a lot of work to try to
Yeah.
organize all of the students and make sure that we don't have multiple students in the same place. But yeah, this year has definitely been different than the past.
I think the way that we need to handle that maybe is, you could tell them once, but if you have to tell them again, just like a kid, then, it's time that maybe
Slap
they
them.
leave.
No, that's not
That-
So you're
that-
suggesting a switch?
Yeah.
Yeah, let me go outside, there's a good tree out here.
I don't get
wet.
I really just don't have time. Like, it,
Right.
you know,
At the end of this,
Just-
I think they
Do
become
what
the
you need to
volunteer
do.
for OR. We're taking your kidney, funny person.
yeah,
That would be tough for you.
I don't know what to do to make it better, and I hate that we gave people bad experiences according to the survey, but I'm not sure.
It's for you though either.
Sure, that's fine.
It's not 100% you. It's the person. You make it. You get out what you're willing to put in. Obviously, like with anything else in mind. So if you make it sucky for you, then it's gonna be sucky for you. It's not nobody else's fault. It's their fault.
Yeah, I used to have the students come back after rotation and talk about how their rotation was. But I quit doing that because then they would come back with negative things. And I would say, you're gonna go in thinking, oh my gosh, Salmon Regional was terrible. They treated her bad. And I thought, no, go in. If you don't have anything positive to say, don't say anything. And
Yeah, because they're gonna be different.
yeah, because you're a different person, and you have a different personality, and you're gonna look at things differently. So, I mean, I'm sure they still talked on the side a little bit, but they didn't do it in class.
Or like students ruining like for other students before they get there. You know?
It's hard.
It sucks. Since they talk about other students at the other facility. It's hard.
Yeah.
Like, it's my business. It's my business. Not your business. I haven't even been here yet. You guys, hello. It's hard.
That goes into those soft skills that you need to help you with on professionalism.
Unless you knew me, then no, I'm kidding. Absolutely, anyway, you can do that. Sometimes the best way to do it is to put them in the middle of it. I think those observations that you brought up are wonderful. It's a wonderful.
I know the students will enjoy hearing that. Yes, we get to scroll in. Yeah. Yeah, because it is. I mean, we have the best place in the OR. We get to see everything.
To not have to do anything.
If you like that kind of thing, right, Barbara? So Barbara she's our community member, and I know a lot of times she's always comes to our meetings, and she thinks, why in the world am I here? You know, because, am I really giving anything to this? But yet, if she meets people out in the public that have any interest in healthcare, she can say, I know about this program, and so, and it are important people. You are important to us, and we're glad that you make the effort to come together. You've got that garden that's at home that you could be working in, but we appreciate you being here, and we appreciate everybody that's here, because I know you guys all have other things to do, but we want the feedback, and you guys know that if you ever need anything, if that things aren't going well, that you can call me and I'll go there, I'll get on the phone, I'll call you back. Because I want them to succeed, and I know how hard of a job it is. I know all of it. So, and I'm glad that I know it. I'm glad that I know, how it feels to be a preceptor, and how it feels to care about these students and want them to succeed, and do everything I can to make sure that they get jobs. But I know that they have to go and they've got to give 100% over there. So, does anybody have anything else? Cassidy, you got anything you want to share with us?
Can I mention we have illegal students? 3 parts. Even some illegal students. I wasn't aware of.
Yeah, our online students are illegal, but it's okay. We're going to make them legal here pretty quick. Jeannie, did you have anything you wanted to? Jeannie she's come on and she's helped our students so much. She's been such a blessing to all health science programs. I can't even begin to tell you everything that she's done. I don't think I'm supposed to tell you.
I'm here because there's a SunPath grant, for those of you that don't know. Students know because I've been in your classroom. But it's a healthcare specific, health science specific grant throughout the state of New Mexico, 11 community colleges. Alamogordo's one. And just trying to offer certificate programs as well as associate programs that might not have been there in the past. And this $15 million grant to help pay for instructors, and you've heard iBest. And so my job is to bridge the gap between education and employment, so that when the students hopefully get it, when they're done, then they need help with a resume or cover letter, then we can work on that, and then they can find a job. Except now that we have so surpassed the number of students that the grant required, we've kind of shifted our lens a little bit to retention. So the students are just like the rest of us, life happens, and so funding and retention have really become our focus now. So we want the students to stay in school, and we want them to be able to have tuition, books, fees paid for. So we have a lot of state-initiated grants and funding that we're using to try and help keep the students in school. So as well as they're having their own struggles within their home sometimes, we're trying to alleviate some of that with funding and help. So I know that I talked to Trish Mall and Melissa Lane about the hospital, when you guys do your scrub roundup or whatever you guys do in the fall, as a donation to our students, because we have students who can't afford their scrubs, they can't afford daycare, gas money, and so that's some of the things that we work on, because that's just the life part. Daycare, those things that make people late and they have their own suffering, and so that's kind of what I'm here for now, is to try and alleviate those burdens. We all have enough barriers in our life that if we can break down some of those walls, then you have a better student, and you guys have a better opportunity to be really, really good at what you do, so that they can focus better when they get to you as employees. So that's why I'm here.
Is there anything you can do about the hospital scrubs?
I could steal them from Ash. I have some. I've just recently acquired some black LuLaRoe leggings, which are apparently difficult to acquire. So I could probably dress up in black and. I grew up in the ghetto in Farmington. I can do this. Don't let these clothes fool you. You know what? There are a lot of scrubs that are donated, and you guys have to have very specific scrubs. So obviously, I can't steal just those. I can come up with some different colored ones. That might be a little more fun.
You can have to help out with something just something just specific, like the book for the
Absolutely.
All right.
There's actually a book loaning opportunity through the Achievement Center.
Oh, really?
The instructors have to provide the book needed for your class each semester, and they provide that to the library. But through the Achievement Center, which they have a grant called the Kellogg Grant for families, they can do book loan. So what you need to do is, I have my cards, I think you guys have my cards already from, is you guys can just send me an email and I can see about referring you to Achievement Center and see if they can get you that one.
Okay,
Sometimes
would they be
they'll
able to
buy
take
it.
it home too, or?
Yeah, it's a loan, and then you just get it back when you're done.
Okay, then.
When you get a job and you can afford to buy that book yourself.
Oh, yeah. Oh, no, I already,
Take it.
I have the book.
Yeah.
If she needs it, that she has it.
Also, just so you know,
Online.
Disability Services, Max has one too, but Disability Services will sometimes, if necessary, they can print them out by chapter for them. They'll do that as well. So we can work out something.
They pay for the copyright on it, so I would always advise students never photocopy the book, although we've all done it. The booksellers today, the publishers, my wife ran 2 college bookstores for the university system. It's the booksellers, certainly not the authors and the creators. They can get nasty, they really can.
What they do through disabilities, they actually purchase the book themselves, and then they make the copy for the student. So it's actually purchased, which you're correct.
Yeah, you get what's copyright.
And Becky, we just recently ordered some books for the library there, so that way those students have access to those books. So I'm sure they have them, but just in case if they needed something. I think they probably received them Friday.
They should have gotten them on Friday.
But it's for someone else.
No problem.
Becky, do you have anything you would like to add?
I know you're having some issues with the online students, and I just want you to keep in mind that we do have ITV services here. So if you ever decided that you wanted them to attend live, we could look at our ITV room schedule to see if we could maybe offer the courses that way.
Okay.
Yeah. So I know it helps to, for those are more or less entry-level people into healthcare, and it may help them get that involvement over, even if it's over ITV. We do that with our nursing students here, and it seems to work real well.
Okay.
Have them do that. McKinn lecture through that, every lecture, no matter what. And then at least one lab a week.
Yeah, it's true.
That's what my whole network was on, interactive video,
Yeah.
interactive video conference. Because the students, as you points out, if you're new to being a student, they're not going to be as motivated as somebody that's had privilege.
Yeah. And they can ask questions, or when the student's asking something, they're like, oh, I didn't think about that.
We would have 12 or 15 classes spread across 40,000 square miles in my service area. And it was a little different equipment than we use, but it was all voice activated and would track you. And it was completely a fluid environment. So you'd have a frame of all the schools. And when a student would raise their hand and the teacher would say, okay, Alamogordo, the kid starts to talk, they become the center screen now.
Wow.
And it's hands-free. It's amazing stuff, but each classroom is about 45,000 versus that.
So
Well, I actually just
These work.
purchased a swivel, and what you do is you put your phone or iPad or whatever on it, and you wear a
An attraction.
yeah, and it just tracks you. So I thought, well, I mean that's good as long as I only wanted to follow me, but when I wanted to follow all the students, I decided I'm stand up during class anyway, so I'll just have to walk over there when they're talking. I'll walk over there, and that way the student can look at me.
So,
Yeah.
what was your question?
Yeah, so
And your turn.
and I think it'll also help.
Get those big lollipop microphones from the 50s.
That one over there.
Yeah, yeah.
Yeah, it actually has a little built-in microphone in it, so
In our
wherever your little
transmitter.
tracker is, it's tracking you, it's recording everything, so.
You have to remember to take those off too, because those, we had some of our lesser experienced adjuncts. When they had a break in like a 3-hour class, and everybody, goes to relieve themselves, their mic would still be on. And,
Like your pastor at church. Everybody
Right,
wants
why
you
don't
the
we
chili
shoot
for
that
lunch.
off?
All right, well, thank you. Does anybody have anything else?
Nice to meet you.
Bye.
Bye.
Let me know if you can come, on the 6th, okay?
Okay, I will do that.
I'll get
Take
you a
care of
safe
you.
room.
Yeah, one of my students works at the detention center. He said it's safe. All right, well, thank
Yeah.
you, everybody,
Who
and
works over there?
we will do this again probably, February.
The X is important.
Yes, in February.
Max, do you have the date of the tour for us?
It's
The what?
October, oh, no, we don't have a tour date yet, but they're going to go. for
On October 17th, they're gonna have orientation.
orientation.
Okay, so shortly after that then, right?
Yeah,
Is there any kind of card you want?
so they're scheduled for October 17th at 9 a.m. to be with
No, for
either
orientation, it's
Zelda
basically just
or-
go there, so they're
I can't remember the new lady's. Anna, I think her name is Anna.
Okay.
Yeah, there's
And
Anna
that's
and
sure
Jennifer.
that she's talking about you guys will actually go to the OR and tour the OR.
Oh, nice.
So that way, like, when you go for the